go. Lovely. Thank you, Rosie. So I'm going to click the next slide. So what we're doing today, simply, we're just here really to let you know the scope of the work that we're covering. We want to let you know who we are and what we bring to the region for the next few months. And we're going to talk a little bit about what the 3 roles are. So social prescriber, care coordinator and health and wellbeing coach. And the regional offer, what we have really to support you over those months. It's really important for us at this really early stage to figure out what it is that you guys need as well. So we're going to be asking you to give us some feedback, to tell us what it is you might need in terms of support and what you might like from future sessions over the next few months. And before we start, because we are a really big group, just a few rules of engagement might be helpful. So I'm going to be introducing a Jamboard in a second. So this is a way that we can share ideas, keep topics of conversation running throughout the presentation. I'm going to encourage you to use this instead of the chat box if possible. I'm one of these people, I find chat box so distracting and I find it really hard to stay on point and keep talking to my presentation if there's lots happening in the chat. So I'll show you how to use the Jamboard and encourage you to use that if possible. The other useful thing about the Jamboard is it's a great way of theming responses. So that'll help us with sharing those ideas back out to you and we can screenshot it and put it in the slides to share. So I'm just going to show you how it works. If you've never used a Jamboard before, bear with me and I'm going to very quickly share my screen and bring up the Jamboard. So in a minute, I will pop into the chat a little link. When you click on the link, it brings you to a page that looks like this. This is the Jamboard. So just imagine it's like a flip chart if we were all in a room together. It has a few pages. So if you can see my cursor at the top, that's page 1. There's page 2, 3 and 4. So you can choose which one you want to answer. And the way to do that is just to take your cursor over to the left, click on a post-it note like that, pop in your response, whatever that may be, click save and it'll appear on the screen. And then you can move it around. It's helpful to move it because sometimes they start to stack up on top of each other and we can't see all the responses. So things to say about the Jamboard are it's totally anonymous. When you appear, you'll appear as an anonymous character at the top of the screen. So if you are wanting to be identified, then you'll have to let us know within the post-it note who you are. So for example, particularly if you want to share any examples of success within the 3 roles within your PCN, it would be really great to know who that is. So that is the Jamboard. If I stop sharing and come back to your faces, and my slides back up. I'm just going to pop the link to that now into the chat box and then I'll just give you a second to jump on and see if you can access it. Oh, there you go. Hopefully that'll come through. Fab. So if you can just jump on and just check if Maria or Michelle or Rosie want to just let me know as well if that seems to be working, that would be really good.
So I can't see the link on the chat.
Okay, maybe it's because I've put the wrong thing in. Okay, well, something had to go wrong. There we go, we got it out of the way. Let me try again. Copy the link.
It's a good video though, Claire. It's a good video.
It's a great video. I'll show you that in a minute. Don't worry about it. Okay, that should be the right link now. I always say personalised care is about humans. So a nice human mistake right at the beginning reminds us all of that. So
yeah, I've been able to get on that, Claire.
Yes, oh brilliant. I can see now. You should be able to see all the little icons at the top you can through as various different animals. So remember that you're clicking on the little post-it note and that's how you bring up something to comment on. So have a little play and in the meantime I will move on with the rest of the slides. And have a look at the stage. So the topics were what help and support would you like to understand or embed these roles, the 3 roles? Topic suggestions for any future lunch and learn sessions. We really want this to be responsive to what you need, and we're not making those assumptions. Examples of success within the 3 roles that you might already have out there already. We really like to hear about that. And then there's a page 4 is anything else. So is there anything that we haven't asked you, any questions that you've got, anything else you want to share? Thank you very much. Okay, so having a look at today then. We're going to start with a bit of context of personalised care, and I'm assuming everyone knows what personalised care means, but I think it's just a really good way to land and to set the context of these 3 roles. We're going to see how they're really critical to achieving the goals of personalised care. And as I said, it is about remembering what we're trying to achieve here. What is this about? How do we connect really with this idea of personalised care, and how can these roles support primary care networks who we know are overburdened to be able to deliver that in a real way? I'm not going to give a really long example, but I will just say I've just spent a couple of weeks ago, I spent some time in hospital. And I had an amazing surgical team. Surgery was amazing. The follow-up on the ward was great. They did all the obs. They hit all of their of the clinical roles they were supposed to do. But often, a lot of the time that I was there, I didn't really feel very human. I felt quite vulnerable. I was in my gown. I was sitting on my bed. And the real standout moments for me, and the people who stood out to me, were those ones who really recognised my humanity, recognised my anxiety, my vulnerability, and it was those moments that really helped me to feel like I was okay. I had this. I'm going to get better, and it gave me a bit of a sense of control back for myself in an environment where I really felt out of control. And I suppose, just not for sharing and not for the chat box or anything, but I think before we start today, just have a little think for yourself. We don't get a lot of reflective time, do we? We're always busy. Just think about maybe a time when you or someone who really matters to you may have been in like a care setting in that way, and there has been that moment where they've just been recognised for exactly who they are, and just really what that might have meant to you or meant to them. I think that's a nice way to start. Anybody who can't get into the Jamboard, if you have anything you want to put into the chat box, that's absolutely fine, and just we can make sure that we add that in at the end. Okay, so let's personalised care. So NHS long-term plan. There's this commitment to giving people the same choice and control that they would have, over their health, that they would have over any other aspects of their life. So really important to acknowledge that. That's that humanity bit. That's the keeping people feeling like they're important, feeling like they're an individual, and they're not just a number or a statistic or a lump of meat. So moving away from this idea of one size fits all model, really focusing on their own strengths as well as the needs that they have, and simply asking somebody what matters to them as opposed to what's the matter with you, and just looking at their presenting problem can make a massive difference in that person really being seen. So for personalised care to work, we know in terms of impact, this needs to be a default approach for all health professionals and everyone across the system. But the personalised care roles are really critical to being able to achieve that, especially under the pressure that we're under at the moment. Again, you've probably seen this, so I'm not spending long on describing personalised care, but it is useful again to think about this, how all of the different components work together to deliver this joined up approach to supporting the needs of each person. So we've got the big blue triangle, which is the whole population, everybody, carers, the individuals themselves, making sure they're staying well, they're connected into a resilient community. That's a really important part of this as well, health beyond just healthcare. And people being able to feel like they can make informed decisions and choices about their day-to-day life and health choices, as well as when their health changes. So that's the whole population. And then we've got the smaller triangle, the mid triangle, which is the targeted, proactive support for people who we know have long-term health conditions and mental health conditions. So helping them to build knowledge, skills and confidence to be able to live well with those health conditions, and giving them support they need to be able to do that. And then we've got this smaller blue population, 5% of the population who we know need specialist, intensive, integrated approaches to managing their care because they have much more highly complex needs. So again, it's supporting choice and control in the care that they receive, but really wrapping that care around. And I think the key is really in integrated and proactive support. So what we're going to see in the next few slides, we're just going to focus on these 3 additional roles and see how they can contribute to delivering that model for the various different patient populations. So the DES, as we know, provides reimbursement for ARRS roles. So ARRS roles, they're broad, there's lots of them. What we're here to talk about today is specifically the personalised care ARRS roles. Most PCNs now should have access to social prescribers. They were introduced into primary care back in 2019. So, but now coming in are the care coordinators and health and wellbeing coaches as well. So these 3 roles are really critical to supporting people to navigate within the system and also outside of it as well, in that community, that, you know, the healthcare outside of the care setting, and to really help people to build the resources that they need to be able to self-manage and live a healthy and a fulfilling life. We know that if we integrate these roles into the system in a really considered way, they can also have an impact on reducing the workload of the traditional primary care staff. And that was one of the main reasons for doing it. And also it's really important that they can have an impact on health inequalities as well, if it's targeted in a clever and considered way. So yeah, that's obviously going to improve the experience of the patient, which is fab, but it's better for the system too. So it's a win-win. I think from a health inequalities perspective, all 3 help. And I think that might be that'd be a really good idea to do a webinar on that on its own. There's loads of opportunities to look at how they can do that, and it's really about thinking about levelling the playing field and really focusing that attention. And from a PCN perspective, when you're thinking about how you're referring into these roles or how you're targeting support for these roles, considering how it can play into your health inequalities agenda is really valuable. So the 3 roles together, there's lots of similarity. They're all taking a holistic approach to a patient-centred approach. They're all working alongside the person. I think that's a really nice way to think about it. Identifying what matters to them, working on the goals that are important to them, and making sure that the support is in place to help them with that. But I think what this little overview picture shows is that they actually all bring a very unique set of skills as well, and they are targeted at different patient populations and to tackle different challenges. So the next section, we're going to have a look at some mini videos and speak to some of the other speakers about each of the roles in detail, and we'll look at those target populations and the added value they can bring to the patient and the staff and the system too. So I'm not going to talk through each of these now, but all of these slides will be available to you, and I think they're just handy to have these like pictorial images that pull it all together. Even though social prescribers have been in post for many of you for a while, and I think they're better understood potentially than the care coordinator and the health and wellbeing coach, I think at this stage it's still important for us to have a reminder of the purpose and value of social prescribing, because we've just, you know, coming out of the pandemic, a lot of people have been redeployed. I think there has been a lot of changes in the way that social prescribing has been delivered. I think that's probably fair to say from what we've heard. So we'll have a little refresh on that, and I think, is it Maria that's going to speak to that slide? Thank you, Maria. So I guess at this stage, just to say to you to think about considering the skill mix of the additional roles that you maybe have already within your PCN. And as we go through the next session, whether or not social prescribing is exclusively delivering its offer within your area, or maybe is it contributing to some of these other roles and their objectives. And just to consider whether or not there would be value or increased value in bringing other roles into the team and then working together. So that's just some thoughts. So Maria, would you like to save my voice for a minute?
Lovely, thanks, Claire. So hi everybody, yes, I'm Maria Willis. I'm the East Midlands Regional Learning Coordinator for the social prescribers. So I support a lot of the link workers. So you'll hear a little bit more about that later from Michelle. But in terms of the link workers and social prescribing link workers, we're really mindful that 1 in 5 of the GP appointments are wider health determinants in terms of when they present. And it's really important that our link workers build up a working relationship with the people they support. It's really looking at what matters to that individual. So looking at those wider health determinants, spending time getting to know that individual. And I really do have to sort of emphasise that, because I think some of our link workers have been utilised in lots of different ways during COVID in supporting sort of primary care. But the key thing of their role is very much around getting to know an individual, looking at their strengths and supporting them as they sort of progress along their journey. So a lot of support around practical and emotional well-being, connecting them to the community, and looking at, as I say, on the strengths of what they can do rather than what they can't do. But they do a lot of work working with the voluntary community and the faith sector. So really looking at those community assets, identifying what's out there, and looking at how they can support that individual through a planned approach to move through to address those wider health determinants. So it could be things around health, it can be things around housing, education, like I say, that those wider parts. But they work really closely with the care coordinator and the health and wellbeing coach. And as Claire said, we're going to start to see how that model's progressing. We tend to work with people that have got perhaps long-term health conditions, more of those complex social needs, those that are experiencing loneliness, but they are given time, and it's that wider relationship that makes a difference for the individuals that spend time with a social prescribing link worker. Hopefully that gives a bit of an overview of that, Claire.
That's great. Thanks so much, Maria. So gosh, time's flying by already. I'm going to ask, if possible, if Rosie can bring up the first video. I'll just give her a second to do that. So yeah, Maria very kindly giving the overview of the social prescriber there. We've got we were going to have Lisa join us today, but she's not been able to make it last minute, and we have got a little video here that gives an overview of the health and wellbeing coach role, so I'm going to play that next. Okay.
Health and wellbeing coaches
Thanks, Rosie.
to take proactive steps to improve the way they manage their physical and mental health conditions based on what matters to them. They support people to develop their knowledge, skills, and confidence in managing their health and care to improve their health outcomes and quality of life. Health coaches do this by coaching and motivating people through multiple sessions to identify their needs and to set goals for themselves, and through providing access to interventions such as self-management, education, and peer support. Health and wellbeing coaches may work with people by phone, by video conference, or face-to-face. Jo has been a health and wellbeing coach for Cambridgeshire and Peterborough Trust for 6 years.
So my role as a health coach is to provide a space for patients to have a conversation about their health needs in a way that really supports them, first of all, to understand what it means to them, what the reality is for them, and for me then to understand how what I do fits into what they need, to really make quite a powerful relationship that is focused around the way forward for that patient or that person in a really supportive way.
Health and wellbeing coaches are skilled in coaching, communication, and behavioural change skills, and work with people at their starting point to encourage and support them to become more confident and engaged in managing their own health. They use a non-judgmental approach that supports the person to self-identify existing issues, and that encourages proactive prevention of new and existing illnesses. Jo explains how her input made a big difference.
Puts them right in the middle of the conversation, right in the middle of the service about, whatever's available to them for them to access. We had conversations around his ideas, what he felt was important to him, what resources he had, what skills he had, what his long-term plan was. He knew he had cancer, he knew that his life had challenges and limitations, but he wanted to get as much out of that as possible. So I gave him the space to work through that and work out what his ideas were. And he did get back into the office. He got back into doing things that he wanted to do and that were important to him. And his wife also, she reported feeling quite empowered because she could see her husband not giving up and actually starting to engage. And it was a really lovely strength building for both of them, and they were able to join back again, you know, as a team, because she didn't feel that she needed to be scared, because she saw her husband taking charge and feeling stronger and empowered. And he was a great advocate for health coaching as well, and he started to talk about that in his communities.
Health and wellbeing coaches can have a real impact in empowering patients to find resources and support to better manage their care. Their involvement can significantly improve the patient experience and journey. For more information, visit www.england.nhs.uk/personalised care/supported-self-management.
Thanks,
This
Rosie. You can
other
stop that.
ways to find out.
Thanks so much. And if you could just line up the care coordinator one, that'd be really helpful too. So yeah, without Lisa here to talk to that, and we are quite tight on time as well, I hope that summarises the role of health and wellbeing coach. I think the key for me is that you can think of the health and wellbeing coach as being really there for supporting behaviour change. So we'll look at the three roles together in a moment, and how they support somebody in a holistic way. It doesn't have to be sort of a person who has specific background in nutrition or smoking cessation. It's more about the way that they have those conversations and the way that they engage in coaching around somebody's individual motivation, looking at intrinsic motivation and supporting them from there. So there's some really good examples across the Midlands of health coaches that have been in post for a long time, with excellent examples of weight loss control with never having had a weight loss conversation, for example. So I'll give you some more information on that anyway. I'm going to sort of shoot through the next slide just for time, but there'll be more information in the slides. And if Rosie can bring up the care coordinator one, I just want to make sure we get through all the steps before we get into the regional offer and what we have here for you. Thank you. So this is a care coordinator. I think you need to put the sound on, Rosie.
Care coordinators play an important role within the primary care network to proactively identify and work with people, including the frail or elderly and those with long-term conditions, to provide coordination of care and support across health and care services. They work closely with GPs and practice teams to manage a caseload of patients, acting as a point of contact to ensure appropriate support is made available to them, supporting them to understand and manage their condition, and ensuring their changing needs are addressed. Care coordinators could potentially provide time, capacity, and expertise to support people in preparing for or following up clinical conversations, to enable them to be actively involved in managing their care and supported to make choices that are right for them.
Care coordinator role is, I am that person kind of in the middle of the pool, and there's care homes, there's GP surgeries, there's social prescribers, there's all the community care around that, and I'm that person in the middle that can bring those people together. I'm employed by the primary care network, and then I have so many allocated GP surgeries that I help with. We're starting now to go out to individuals within GP surgery, so vulnerable patients, housebound patients, patients with learning disabilities. We are starting to kind of sift through all the patients in the surgeries just to see if anybody needs any assistance, because the whole role of the care coordinator is to make sure that everybody is kind of in charge of their care and how that care is given to them, so they have a say in how their treatment is carried out. And that's what we're here to listen for, and to make sure that that is okay and everybody is happy with how they're being treated. So everybody will have a personalised care plan to get those voices heard, because I think for some people their voices haven't been heard for a very long time, and they are told what is going to happen to them and what care they're going to have. Whereas sometimes people are frightened to speak up as well. Although they have a voice, they're frightened to use it because they don't really want to say, well, actually, I'm not quite happy about that. Could we try something else? Whereas I can be that voice, and if they can tell me that they're not happy. It's so important, and I think it is such a great step forward for everybody's care.
For the most vulnerable people in the community, care coordinators can be the go-to person if their needs change or if something goes wrong with service delivery. They can help reduce unnecessary appointments and acute hospital admissions. Their role can have a big impact in reducing health inequalities. For more information, visit www.england.nhs.
Fab. Thank you so much. So yeah, again, a kind of brief video really explaining the role of the care coordinator, but the care coordinator for me is really, the key thing is around identification of vulnerable patients and that proactive offer. So we're talking about the top of the triangle, so people who are in most need, so potential frailty, looking at reducing the likelihood of people falling through gaps, unnecessary appointments, and a real key player again in addressing health inequalities and targeting that support to people who would struggle to navigate the system on their own. The care coordinator links specifically as well into personalised care and support planning, which the social prescriber can also do, which is about helping people to tell their story once, again taking a strengths-based approach and helping them to identify what their needs are and the support that that is required to be able to meet those needs. It's also really helpful in terms of supporting people to prepare for clinical conversations and after clinical conversations as well. So that shared decision-making element of personalised care fits in there too. I'm going to bring up my slides. So there are some slides that describe these roles as well that you'll get sent out to you, but I think this is a nice graphic just to have a look at how the three roles work together and wrap around the patient. So the similarities, again, as we said, are the bits it's personalised care, it's the taking that personalised in a holistic approach to finding out what matters to a person. But the way, hopefully what you've seen from Maria speaking and those two videos, they are a different patient targeted group. So these roles, they're all to be part of a wider MDT. They don't work just alone, obviously, together. And they can be really useful peer support for one another as well, as they have that shared experience of entering into a clinical environment as a non-clinical role. This particular example here shows a referral coming in through social prescribing link worker as a single point of access, but we know in practice that isn't the case on the ground, and referrals certainly can come in from all different routes. As we just heard from the care coordinator, they may well be doing risk stratification and direct tailoring of support to frailty and risk registers, for example. So don't worry too much about the single point of access. I think the key is to say that they all work together, and between themselves they can offer that full support. So I always think of social prescribing as being really that outward reach, outward into the community, supporting community resilience and helping people to access the support for the wider determinants of health. So that might be other statutory services like housing, but it might be the voluntary sector. Your care coordinator is doing a really similar role, but on the inside of the system. So they're helping people to navigate through the health and care sector, making sure that they don't fall between gaps, and really being a voice and an advocate for them as well, particularly for those people with most complex needs. And then the health and wellbeing coach in the middle there, supporting people to develop that confidence and knowledge to be able to make the changes that they want to make in their own lives. So the three roles work together really nicely. And what we're looking for, actually, if you have got examples of having these three roles in practice in a specific PCN, we would really like to talk to those three roles and talk about how they do that. We have got one more video that shows how the three roles work together. I'm not sure about the time. Yeah, I think we'll show it, and then we'll go into the support offer. So it's a bit of a longer video, but it's a great example of Kay. She's a care coordinator who's based in Birmingham, and Mundev, who's a social prescribing link worker, and they work together as part of OHP. We've also got Joe in this video, who's a health and wellbeing coach based in the Black Country, who works closely with them, but it's a bit of a fictitious patient they're talking about, but it gives you an example of how the three roles can really wrap around and support a patient together. So Rosie, I don't know if you've got that next video ready. And when we come out of this, what we'll do is we'll finish, we've got we'll have 10 minutes left, and we'll talk about how Maria, myself, Lisa, and the care coordinator mentor can really help you as PCNs to put this into practice and give you some support if you want to take on any of these roles, or if you need support for those already in place.
This is a short video explaining how the roles of a social prescribing link worker, a care coordinator, and a health and wellbeing coach could possibly work together. There are some similarities across these three roles in that they all enable people to develop the skills and confidence to manage their own health and wellbeing. But we're now going to spend a few minutes exploring the difference. And I'm going to hand over to Kay, who is a care coordinator.
Thanks. As Jo said, I'm a care coordinator, and part of my role means that I bring together all the information about a person's care. I've recently been working with an 83-year-old lady. She's got diabetes and is obese. She also suffers from loneliness and has low-level anxiety. So we've been working together to develop a care plan for her, and one of the key aspects is to work with a multidisciplinary team to help her with some of these issues. This is achieved by bringing together all the information about her identified care and support needs and exploring options to meet these within a single personalised care and support plan based upon what matters to her, because that's what personalised care is all about. One of the first people who could help with this would be the health and wellbeing coach.
Yeah, you're absolutely right. Thanks, Kay. That's definitely where we would come into this story, because typically I do work with people like that, somebody who's managing maybe several long-term conditions, and obviously in association with managing and juggling those conditions, we usually see some form of low-level anxiety or mental health issues, low mood, for example. And often people really just feel overwhelmed and they're not really sure where to start or when to start. It could be that it's a new diagnosis that's completely floored them. It could be, again, it's one more diagnosis on top of many others. And it could be that they've just maybe afraid to even start thinking about trying, because every time they've tried to make changes in the past, they've just failed. So yes, certainly health coaches, we concentrate on behavioural change. We offer hope, we offer optimism, we break down what they could do into small achievable goals, and that are always around what matters to the person themselves. But certainly when you're talking about somebody who has social issues, who's maybe isolated, lonely, I'm very much thinking about social prescribing link workers, and my colleague Mundev could possibly help with that.
I can help the patient link into online social groups and encourage them and support them to also join local walking groups that I'm running. And this can help to minimise and improve well-being physically and also mentally. With individuals that might have anxiety, like you described, Kay, we can start off, maybe doing a one-to-one walk, and then introducing them to a group when they feel a little bit more confident and less anxious. Alongside the walking groups, we're also running online exercise classes that can help people with weight loss. We've also got a weight loss group that can help them to lose weight, and it also improves their health and well-being. And there is also a social aspect to the weight loss groups as well, about sharing what works for different people. In addition to the classes that we run in the walks, I can also help with signposting to lots of different local support organisations, which can help with benefits, housing, social support, and also touching on the anxiety and possibly low mood. I can signpost to organisations such as Birmingham Healthy Minds and Sandwell Healthy Minds, depending on where they live. And thinking about how we're all working together, I strongly feel this is, such an amazing way to work, where we can really focus on the person-centered approach and give the patient the best support they need along the way on their recovery and well-being journey. Because I think initially when I first started this role, I did feel very isolated, and I felt more PCN roles coming into the fold, as it were, made me feel more confident that I wasn't working on my own and that I wasn't alone on this journey. And I think that's the key, that we need to understand that we're not alone. There are different support kind of staff available, such as yourself, Kay, and yourself, Joe. So, you know, it's comforting and motivating to know that, you know, we have this team behind us and that we're not alone.
You're absolutely spot on, because we do have to work together as a team. And even though this example is showing it starts off with a care coordinator, it may not start off with a care coordinator, because it's like a cycle, isn't it? We can go around in a cycle. So I could refer into you, you could refer into me, Joe could refer into me, whichever way it works. So as long as we're all working as a team and the communication channels are open, that's great. So part of my role at the end of it, coming full circle, would be to make sure that the care plan's been implemented properly and to check up that the person's got what they wanted and needed from every part of the team. So questions like, have you seen the health and wellbeing coach? Have you seen the social prescribing link worker? Did it go well? Just really checking in with that person, because all we're trying to do is to make sure patients don't fall through the cracks, and so that they have a smooth and happy journey when trying to get the help and care that they need.
Brilliant, guys. I think that's perfect. Thank you.
Thanks, Rosie. Thank you, everybody. Great. So bringing the slides back up. I've just been having a chance to have a look at the Jamboard, which is great. Thank you. So many people have commented in there already. So that's going to be really great in planning the next few sessions that we do. I'm just going to move on to these next couple of slides. So this one is really around the responsibilities that are placed on the PCNs, and I think this has come up in the Jamboard. Again, this is an introductory session. We will have to say we had 45 minutes today. We didn't want it to be 2-hour session. So it's just to say we're here, this is what we're covering, and this is what we're going to be sort of going into for the next few months. So we might want to do more sessions on each of the individual roles. And definitely potentially one on Des responsibilities. But in short, one of the things that we're hearing quite regularly is there is a lack of clarity around training and support, particularly around supervision. So we are planning to run a webinar in the next few months outlining some additional guidance that's coming out to support PCNs around supervision. NHS England are developing various different test sites, so there will be changes, and we'll update you as soon as we get that. There is also some e-learning that's coming out through Health Education England that's going to be supporting social prescribing link workers directly, and I believe that that's then going to go on to the other roles too. And that's really to help them to understand the purpose and value and what to expect from clinical or professional supervision, as we're potentially now going to be calling it. So these bullet points here are what will be written in your DARES. So depending, obviously, the line management, if you've got social prescribing link workers that are hosted by a voluntary sector organisation, the line management will be picked up with them, but you'll still have contractual responsibilities around that. And so, yeah, the basics, what we're hearing is certainly some of the issues around equipment, IT systems and so on are less of an issue now than they were. But obviously for people to be able to do these roles and to be really integrated within the system and working as part of an MDT, they need to be able to access these. It's just to say that we're here, and my role is very much, in fact, I might just go on to that right now. If that's okay, Michelle and Maria, I'm just going to skip forward to talk about my role, because I think that will just link quite nicely with that. So my role is here to support any PCNs with the embedding of these roles. So to have individual conversations with you, to meet with your teams, to talk about any issues that you might have, any potential options that you want to take moving forward with your ARRS funding. So yeah, that targeted support to you individually to really embed the roles and make the best out of that. In practice, that means that we're going to be running regular monthly PCN webinars, which will follow on from this, and those topics will go on to explore training and development needs, workforce issues, supervision, and anything else that you've mentioned in the Jamboard today. We'll do some management of those themes and make sure that we're responding to your needs. And certainly where capacity allows, feel free to contact me directly. I've just put my email address into the chat box, and I'd love to hear from you. This is really just the beginning of highlighting that these roles exist and getting the comms out there on that. So very happy to have individual conversations with you because it really will be based on your own PCN priorities. It's very difficult to do that right across the board. Everyone's going to have a slightly different starting point. In terms of feeding back up into the system, it's really important that we get that insight and soft intel from you guys and feed it back into the regional and the national team. So understanding any issues that you're facing and the workforce themselves are facing, in order to be able to address those and to support you all with possible solutions. And as well as the negative, obviously we really want to see the good practice as well. It's really important that we see, particularly if you have got examples of the 3 roles working together, but any best practice and practice where you're working closely with the voluntary sector would be really good to hear from you too. So we can collect that evidence and feed it back up. So I see myself as a bit of a facilitator between the national team and what they're hoping to achieve and the reality on the ground. So definitely get in touch with me for, see what we can do to support you with that. I might just bring in, is it Michelle, you're going to speak about the Regional Learning Coordinator role?
Yeah, thank you. Sorry, Echo. I'm happy to say a couple of words about that. Just to reiterate what Maria said as well. So Maria covers the East Midlands and I cover the West Midlands. And our role is very much around providing peer support. Talking about the human touch, Claire, I've now got a dog scratching to get in the sorry. So our role is very much about facilitating monthly peer support sessions, being able to support link workers. And I think for those of you on the call, you'll be aware that link workers tend to be employed via PCNs directly or via the voluntary sector, so subcontracted out, and our roles cover both link worker employment roles and also supporting inductions, training. There's so many materials that are already out there. You referred to the Health Education England training modules that are free. There's also induction packs. There's a whole load of information that's really invaluable that's already being developed, and so part of our role is providing the support to the link workers, but also ensuring that those employing the link workers and there to manage and supervise link workers have access to materials and support as well. So I know we're rushed for time, so I won't, I'll move on really quickly, but just to say we will put our contact details in the chat, get in touch, and we're happy to have conversations about how we can support you and work with the link workers to ensure that they can work as part of the personalised care multidisciplinary team roles.
That's brilliant. Oh, thanks, Michelle. And yeah, so Michelle for the West, Maria for the East, and we don't have Lisa with us today, unfortunately, last minute, but she's the health and wellbeing coach mentor, and she's a very similar role to what Michelle has just described, but for the health and wellbeing coaches. So again, supporting with peer support groups, mentoring support for individual health and wellbeing coaches. She's great as well just to tap into if this is a new role that you're taking on, in the same way that Michelle said, around just resources, recruitment information, induction packs, whatever it might be. So just tapping in and making sure that you're linked in with the mentors for health and wellbeing coaches and the regional learning coordinators for social prescribing link workers is great. So someone's just asked, what about the care coordinators? So as it happens at present, we have a vacant spot in the Midlands for the care coordinator mentor. However, we have got an interim offer in place at the moment now with Deborah O'Nions. So she's the national mentor for care coordination. So she's going to start facilitating peer support sessions for the Midlands anytime now. She's also linking people into the national support in terms of share and learn for care coordination too. And in the same way, again, there's lots of resources there. I mean, most of it's on the NHS Futures platform. You can find it yourself, but sometimes just doing that when you're busy and you're kind of overwhelmed with everything else isn't helpful. So just having somebody to turn to who can point you in the right direction. And Debbie could definitely do that on behalf of the care coordinators. As unfortunately we don't have somebody specific to this region. So hopefully that helps. I am going to, so what we're going to do, because we are literally 2 minutes over time now, I'm going to make it an hour next time. That's my first learning piece. I'm putting into the chat box a little feedback form and MS forms. I really would appreciate you taking a couple of minutes at the end to fill that in, just to let us know how it's gone today and what you need moving forwards. The dates that are up on the screen now are the provisional dates for the next 4 webinar sessions. And what we'll do is we'll go back, we'll read through chat, we'll have a look at the Jamboard, and we'll pull together something that feels like it's really relevant and useful for you from the team, from the MS forms feedback too. just want to thank you all for today, for coming. It's been a really great turnout, and hopefully it was helpful to see that there are some humans here with their dogs and their technical issues that are here to support you and really want to help you to make the best out of these roles. I know it was a fast sort of introduction through, but we can take our time now from here on in, and happy to have any individual conversations with you all as well. So thank you very much for attending, and hope to see you all soon.